Jared Smith with the Healthcare Platform, decentralized health management, health records management platform. Health records management. What an exciting field. Health records, medical reception. What exciting, fun industries. Not. This application design has several features. It features different actors, including the user, the patient, user, and the other users are going to be, well, the healthcare providers, doctors, and facilities. Facilities that do physical therapy, lab work, imaging, and other diagnostic types of tests. Facilities, right? So, the star, the main actor, is the patient. The patient. And they are the consumer in this application. They are purchasing goods and services, primarily services. They're purchasing services. And so they need to find a physician. You need to find a doctor. You need to find treatment. You need to get better. You have something wrong with your health. Something needs to be improved. So you search. You create your profile. Create your profile. Profile can have many things. You can start with as bare bones as you want, and you can add to that as you build up your profile. And those things can include your diagnostic tests and all the other things that go along with your health record. Notes from other doctors that you can see, all your prescription information right there, handy for you to access at any time. It's managed by you. It's not logging into one healthcare facility's patient portal and then another one and then another one and another one. That's a little bit overwhelming. That's a little bit too much. This puts it in one place. It puts it in the patient's power. And then it attracts providers to there because the patients there are there looking for providers. Patients are looking for providers. What do providers want? They want to come to the marketplace. That's what this is. It's a healthcare marketplace. Yeah, this is antithetical to socialized medicine. It's free market. That means that things that aren't really sanctioned or approved by the insurance industry can exist. Yeah. So, patient logs in, they've got their profile, they've got their whatever diagnostic report, their CAT scan, the ultrasound from the pregnancy, whatever it is that they have on there, it's there. It's got the date, the diagnostic facility, everything on there, it's got that record. The patient can select those records and share those with other providers of their own choosing. Say, I want to share, I want to find a provider, I found a provider, hey, I got this issue right here. Here's my diagnostic reports. Send the note to the provider. Send the diagnostic information, those records. Send that on to that particular physician. The patient has control over that. The physician then can look at that and say, oh yeah, we have an appointment on this date at this time. The appointment can be made. The appointment is made with a contract. The contract comes with an agreement to pay. The payment is taken when the patient agrees. The payment is taken from the patient. Okay? So the patient has an account on there with payment. There's a dispute resolution should there be a problem with the appointment, such as the doctor being too late and not fulfilling their end of the contract. Then there's a facility for dispute resolution or any other unprofessionalism on behalf of the doctor, where the doctor should be refunding the patient the money, or so the patient feels. So now we have dispute resolution, we have search, we have a payment system, we have a star ranking system, right? So you can actually rank your physician. Okay, so then you can see, oh, we have a ranking of a 2-star physician, late 40 minutes, late 2 hours, late 75 minutes. I'm not going there. Nope, I'm going somewhere else. So then you can figure out who's good and who's not right within the application. And that is my idea. Now, it doesn't sound like a huge idea, like why can't you have this in? Well, there's nothing like that now. And so the smart contract ensures that payment is made right away. And that's made through, again, as I said, the smart contract is already made. Can be determined in any currency that is deemed suitable for this particular application. Um, the cryptocurrency space is hot and exploding. So that could be certainly a great application of such technology. Um, but the core of the application is really, it's the guts and the rules of the engine itself that are determining the overall goodness. The side effects of this are the elimination of, did you notice there's no more real need for a billing industry? No, that can be eliminated. An entire industry could be eliminated by this application. That could reduce and eliminate a lot of jobs. Another industry in which jobs can be eliminated is medical reception, because now it is no longer necessary to have medical reception. Now it's done primarily through the application. The doctor can, while doing his doctor things, such as, I don't know, driving his kids to daycare or getting ready to play a game of golf or moving the couch cushions to find the television remote, or whatever other doctor things the doctor may be doing, can receive a text message indicating something is going on with a new or existing patient, can make the determination to click and check it out and make the appointment, confirm an appointment, cancel an appointment, all right there in the app within a matter of a few minutes. And that's entirely possible because the calendar application is built right into that app. Oh, it's built in there. Okay, well, looks like you're free in this particular time, which you've blocked off as work time, but you're free then. So let's make that appointment. So then you can make the appointment with a patient. The patient can make the appointment. And that can all happen without any medical reception. It's done. It's all done through the app. Now, there may be cases where it's nice to talk to a live human and somebody wants to talk to somebody in the office, and maybe there's some need for them. I'm sure there's probably something they can do, like, I don't know, taking out the trash, or greeting people with a smile when they walk in the door, or I don't know, something. Maybe just a greeter. I'm not sure. But there's probably something they could do if they really wanted to, pay for the extra cost of having medical reception. So they maybe would eliminate maybe 80% of those jobs. But still, 80% is good. That's eliminating a lot of jobs. That means the doctor has fewer expenses and can focus more on the practice itself, and can thus save his own time and eliminate much of his job. So instead of working 40 to 50 hours, he can work for 15 to 20 hours per week. Great. That's my idea. That's my design of the application as orated by me, the inventor of this idea. So don't steal it. I need your help to design it. You're probably not able to. You probably have about as much wherewithal to see through the entire thing being completed as I do. But if you have maybe a little bit more connections in the industry and some business sense and savvy, it can help me to find some of the infrastructure developers for the back end of the application to set up the cryptocurrency and the payment system with the providers to get the records to be transferred in to the application. Then we can talk. We can have a conversation and we can make this thing actually happen. My idea.